Hello and welcome. Today we're diving deep into Gitelman syndrome, a rare but fascinating genetic kidney disorder. We'll explore its causes, how it affects the body, and what can be done to manage it. Gitelman syndrome is primarily caused by mutations in the SLC21A3 gene. This gene provides the instructions for making a protein called the thiazide-sensitive sodium chloride cotransporter, or NCCT, located in the distal convoluted tubule of the kidney. These mutations, which are usually inherited from both parents, impair the function of this cotransporter, leading to the characteristic electrolyte imbalances seen in Gitelman syndrome. Now let's delve into the pathophysiology. The NCCT protein normally reabsorbs sodium chloride from the urine back into the blood in the distal convoluted tubule. When this protein is dysfunctional due to the genetic mutation, the kidneys are unable to properly reabsorb sodium and chloride. This leads to loss of these electrolytes in the urine. The body tries to compensate for this sodium and chloride loss, ultimately affecting other electrolytes like potassium and magnesium, leading to low potassium levels known as hypokalemia and low magnesium levels known as hypomagnesemia. Additionally, calcium excretion in the urine is reduced, which can lead to a paradoxically low calcium level in the urine. The renin-angiotensin-aldosterone system is also stimulated, further contributing to potassium loss. Gitelman syndrome is a relatively rare disorder, affecting an estimated 1 in 40,000 people. However, because many individuals with Gitelman syndrome experience mild or no symptoms, it's likely that the condition is underdiagnosed. It's typically diagnosed in late childhood or adulthood, though it's present from birth. It affects males and females equally, and it's found in all ethnic groups. The signs and symptoms of Gitelman syndrome can vary significantly from person to person. Some individuals may be completely asymptomatic, while others experience a range of issues. Common symptoms include muscle weakness, fatigue, salt cravings, dyspalpitations, tetany or muscle spasms, and in some cases growth retardation in children. These symptoms often stem from the electrolyte imbalances we discussed earlier, particularly hypokalemia and hypomagnesemia. Diagnosis of Gitelman syndrome often involves a combination of clinical findings and laboratory tests. Blood tests will typically reveal low potassium and magnesium levels. Urine tests can show low calcium levels and increased sodium and chloride excretion. Genetic testing to identify mutations in the SLC21A3 gene can confirm the diagnosis. It's important to note that other conditions can mimic Gitelman syndrome, so a thorough medical history and physical examination are crucial. While there aren't distinct classifications or types of Gitelman syndrome in the traditional sense, the severity of symptoms can vary greatly, leading to a spectrum of clinical presentations. Some individuals may have very mild symptoms only detectable through lab work, while others may have more pronounced symptoms that significantly impact their daily lives. The treatment for Gitelman syndrome primarily focuses on managing the electrolyte imbalances and alleviating symptoms. Potassium and magnesium supplements are often prescribed to hypokalemia and hypomagnesemia. A high-salt diet is often recommended to compensate for sodium loss. In some cases, medications called potassium-sparing diuretics may be used to help retain potassium. Regular monitoring of electrolyte levels is essential to ensure that treatment is effective and that electrolyte levels remain within a safe range. As Gitelman syndrome is a genetic condition caused by inherited gene mutations, there are no specific preventative measures that can be taken to prevent its occurrence. However, genetic counseling is available for individuals with a family history of Gitelman syndrome who are considering starting a family. This can help them understand the risk of passing the condition on to their children. The prognosis for individuals with Gitelman syndrome is generally good. With appropriate treatment and management, most people with Gitelman syndrome can live normal, healthy lives. While they may need to take supplements and monitor their electrolyte levels regularly, the condition usually does not significantly impact their lifespan. Research is ongoing to better understand the long-term effects of Gitelman syndrome and to develop more targeted therapies. Recent advances include studies exploring the role of specific genetic mutations in disease severity and potential new drug targets for correcting electrolyte imbalances. Thank you for joining us on this exploration of Gitelman syndrome. We hope this information was helpful and informative.